Hello, my name is Natalie Edwards. I'm a librarian at Middle Georgia State University, and I'm here to tell you about evidence-based practice and library research. Evidence-based practice, often referred to as EBP, is a holistic approach to patient care that integrates the patient's values and expectations with the best available evidence and clinical expertise. Rather than applying cookie-cutter treatment plans, EBP is a personalized approach to patient care valuing clinical research, evidence, and the patient's unique pathophysiology and environment. Let's talk about evidence. Evidence always exists, but ideally you want the highest level of available evidence. Opinion is never evidence. It is not considered EBP if evidence is not used in your treatment plan. When preparing an EBP treatment plan, you want trials and systematic reviews of trials, anything that involves the actual treatment or observation of patients. In the hierarchy of evidence used in an EBP treatment plan, you should look for the following: randomized trials, systematic reviews of randomized trials, systematic reviews of observational studies addressing patient-important outcomes, observational studies addressing a patient-important outcome, physiological studies, and lastly, unsystematic clinical observations. While unsystematic clinical observations are lower level, they are still considered evidence, much more evidence than opinion, because a treatment and outcome were documented and observed. An opinion is not a tested and observed form of evidence because there is no testing or observation involved. While looking for evidence, there are several characteristics that can signal a study as high level. Characteristics to look for are prospective studies where subjects are enrolled and outcomes are evaluated, randomized assignment of individuals to groups by chance, blind, in which participants do not know if they are assigned to the control or experimental group, placebo, where the control group is treated with a placebo or sugar pill as a baseline to compare with the experimental group, concealment, where the person making decisions is also unaware of which group participants are assigned. This is also called double-blind. And parallel design, where participants are randomly assigned to a group, an intervention is applied, and the outcome is identified for each participant. In a parallel design study, participants never change from one group to another. A control group member will never be transferred to an experimental group, and so forth. When you begin researching, you'll see a lot of studies described as qualitative or quantitative. There's a big difference between the two. I like to think of quantitative as quantity and qualitative as quality. Quantitative studies are measurable data such as height, weight, and other data that can be ranked. These statistics can uncover patterns or relationships between variables. The results can be statistically analyzed. On the other hand, qualitative data collects data about experiences, emotions, behaviors, and other non-measurable variables. This data is also important to EBP because it gives a better understanding of social interactions, cultural phenomenon, or other complex concepts that can be missed in quantitative data. For instance, if you are studying asthma, results in rural versus urban settings would be different because of the environment. Qualitative studies often use open-ended questions, interviews, case studies, participant observations, and other similar methods to collect data. When you're researching, you'll encounter study descriptions like mixed methods, systematic reviews, meta-analysis, and literature reviews. A mixed method study includes both qualitative and quantitative research. Similar to EBP, It provides a holistic approach that combines statistical data with contextual insights. Systematic reviews focus on a research question and gather studies that address that question. A meta-analysis examines the results of several quantitative studies to look for new trends or patterns. A literature review is not considered primary research. A literature review provides an overview of the previous research done on a topic. Many studies combine several of these methods. If you are ever unsure which method a study uses, it is often listed in the paper's title or the methods section of the paper. If you do not recognize the term they use to describe their method, you can always Google it to find the definition. Quantitative studies often use the mean, median, and mode of the results to summarize and measure their results. The mean, also called the average, is when the sum of all the scores are divided by the number of scores. This is a single number that can be used to describe the value of the entire dataset. However, an extreme value, or one that is very different than the others, can influence the average. The median is the middle, or 50th percentile. Since it is in the middle of the dataset, half of the variables will be above and the other half below. The mode is the score that appears the most. For instance, if you needed a mode of test scores in a class, if the majority of students made a 95, the mode would be 95. Now that you know what you're looking for, let's talk about evaluating your sources to make sure they are reputable and fit within the scope of information you need. One evaluation method I recommend is the 5 W's. When you go to read your papers, look for the following. Who wrote the article? Are they qualified? In the author section of the paper, you can see the list of authors and other contributors. They'll often have degrees listed with a name. If you aren't sure, you can always Google the author to see what else they may have written. What is the purpose of the source? The purpose of a research article should be to educate the reader. It is not a popular source, which is meant to entertain readers. Many research articles list the purpose early in the paper. Where was it published? There's a big difference between self-publishing and a peer-reviewed journal. If you do not recognize the publisher, do a little background search to make sure they are reputable. When was this source published? It is important to make sure that the research you are using is up to date and still relevant. Many medical or science tracks want research within the past 5 to 7 years. And finally, why? Why is this source useful? Ask yourself if it adds anything to your evidence or clinical expertise. If the answer is no, trash it. When building an EPP plan, you want to concentrate your time on research that strengthens your plan. If you are ever unsure if a paper is trustworthy, you can always ask a librarian, and we can help you do some background research. Now let's talk about how to read research articles. The way you want to read research differs from how you might read a humanities article or a book. When you first look at an article, you want to skim it and look for certain items to make sure it fits your needs before diving in deeper for the specifics. First, take a look at the abstract. The abstract will give you an author-provided overview of the article. This can often be used to preliminarily check that the topic and hierarchy of evidence fits your needs. Next, skim and make note of the purpose, research question, research methods, concepts, results, interpretation of results, and anything else you may want to come back to. Once you gather this information from your article, you will have a clear sense of whether it meets your needs, and you can dive deeper into the article specifics. From there, you can begin to build on the research. Imagine each research paper and trial as a brick in a wall that constructs our understanding of a topic. Each article builds on the previous one, contributing to a more robust comprehension. To enhance this knowledge, we synthesize information and employ thematic grouping to examine past research. Through synthesis, you summarize key points and connect ideas to form new or deeper insights. With thematic grouping, you analyze qualitative data by identifying patterns or themes in the results and organizing the information to gain a clear understanding. As you go to complete your own research, you want to start with a research or clinical question. PICO is the framework used in evidence-based practice. PICO stands for patient or problem, basically who requires treatment or what is the ailment. Intervention, how should the problem or patient be treated? This does not necessarily have to be an action. Intervention could be in the form of exposure or even the patient's perception. Comparison. Are there other solutions? Are there studies or trials that cover alternate interventions to compare to your own population intervention? And lastly, outcome. What is the desired result of intervention on the population? What is your measurable outcome? This statement must be specific in order to determine the result. When you go to complete your search, you'll use Boolean operators to let databases know how your search terms are connected to one another. And is used to find results that include both of your terms, both or all of your terms. For instance, addiction and chemicals, we put and in there, and so we'll find results that has both addiction and chemicals. Or is great if you're using synonyms. In our example, vaping or e-cigarettes. While some authors may use vaping, some may have used e-cigarettes. Not is not used too often, but you may have to use it occasionally. Not is used when you're getting a lot of really irrelevant results. You can use that to kind of narrow it down. If you're having a lot of trouble finding searches that work and give you relevant results, please contact a librarian and we can help you. So in our example, we're searching for vaping or e-cigarettes and addiction and chemicals and lungs and heart. Well, there's a lot of open source information available to aid you in your research, such as Google Scholar, the NIH, and the CDC. The library subscribes to several different medical databases with a wealth of up-to-date and reputable information available. We have organized all of these resources in the Respiratory Therapy Research Guide, available on the MGA Library website. You've heard me use the terms database and Galileo. There's a difference between the two. A database is a specialized collection of scholarly materials that are subscription-based. When you do a database search, you search in a single collection. It gives you targeted results since most databases are specific to a certain field. However, you could be missing valuable articles available in other databases. When you search in Galileo, you're searching through all of our available databases. This may sound like the better option, but in large searches, some relevant articles may get missed because the search has so many places to look. It's important to keep this in mind when searching. In a Galileo search, each listing tells you what database it came from. If you see a lot of great articles from one or more databases, you may consider searching there for other articles. Let's start searching now. You can get to the MGA Library website from mga.edu. The link can be found when you hover over the Academics tab or from the menu here in the top corner. Right there in the middle it says Library. If we browse the library site, you'll see the Galileo link and the Research Guide link here at the top. If you scroll down, here's the link to make a research appointment with a librarian, We are available online and in person on every campus. If you need an appointment but you do not see the time or location you need, please email us at library@mga.edu and we will accommodate you. If you scroll further, you'll find our hours and our MGA Library chat. This chat service is available during library hours and is staffed by MGA Library staff. Earlier in this video, I mentioned the Respiratory Therapy Research Guide. To access our guides, click on the Research Guide tabs at the top of the library website. Our research guides are arranged by school. The Respiratory Therapy Guide is found underneath the School of Health and Natural Sciences. Here you can find direct links to suggested databases for respiratory therapy searching. Now that we know where to go for our database list and our searching options, let's do a Galileo search. From the MGA Library website, we'll click on Find Articles Galileo. On Galileo, you have the option of doing a bento or classic search. In our example, we are doing a bento search. Let's break our example search up and search for vaping or e-cigarette and chemicals. Your search terms will also work in database searches. We want to click on the peer-reviewed articles section. All peer-reviewed articles are scholarly, but not all scholarly articles are peer-reviewed. Peer-reviewed journals have every paper submitted reviewed by experts before publication. Some papers are rejected while others may go through several rewrites before it is approved for publication. From here, we have a few filters we want to use before we've got our search set. First, we want to click on Full Text Only here underneath the search bar. These will only show us articles we have full access to. Next, we want to use the publication date filter. Since most health research should be published within the past 5 or 7 years, use this publication date for past 5 years or use the custom range to put in your date range. For this option, I'm going to click past 5 years. As you see, the number of results has drastically decreased. From here, I can browse through the results. If you have trouble finding an article, please contact a librarian. We are happy to assist you with your search. Let's look at this article. Here at the top, you can find what database this article is in. If you like an article, I may suggest checking to see if there are any subjects or terms listed. You might find a new or better term for your search. If this page does not have an abstract, click on the Access options to retrieve the full text, and there should be an abstract there. All of the information you need to cite this article is found on this page. Galileo also has a few tools to aid you in your organization and research. The option you will find most helpful is the Cite option here in the top right corner. It looks like a quote. You can use this drop-down to select the citation style you need. I do suggest that you check these citations. These are computer generated, so it's possible it may not be correct. If you ever have any kind of question about your citations and how correct or incorrect they may be, please contact a librarian. I also suggest the share tool, the sideways arrow. You can email yourself a copy of the paper, or you can save it to Google Drive or OneDrive. You also have the option to download the paper here, this last option, with the arrow pointing down. I suggest that you save copies of your articles somewhere else, whether it be in your email or on a flash drive. If you leave your articles open in different tabs on your computers, eventually your session will time out and you'll use all of the articles that you found. Lastly, let's discuss citations. You should cite to give credit, avoid plagiarism, allow your reader to locate your sources, and to demonstrate that you're building on and interacting with other scholars. You should cite when you quote, summarize, or paraphrase someone else's words, ideas, or creation. You should cite both in text and on your Works Cited page. If you need help with citation, please feel free to contact a librarian. We're always happy to help you. We can do that online or in person. We have a MGA citation research guide available, and we also suggest Purdue Out, an outside website, for a quick reference of how to cite certain items. As we close our presentation, here are a few things to remember. Evidence-based practice integrates the patient's values and expectations with the best available evidence from systematic reviews and clinical expertise. Opinion is not evidence. Remember that research is a process of trial and error, so don't get discouraged if your first searches don't work. Ask a librarian for help. We are available online and in person, and we are always happy to assist you.